Greetings to everyone. I'm here to present to you the corrections of these questions given to you by Excellence Academy, a reference bilingual group by Excellence specialized in mentorship, orientation, and preparation of the residency concours in Cameroon and abroad. So there are questions of surgery, the instructions. Each question or statement below is followed by several propositions. Select the statement that best answers the question or best completes the statement. Question 1. In a series of gastrointestinal radiographs, an enlarged duodenal sweep with downward and rightward displacement is often consistent with which of the following conditions? A. Abnormal position of the stomach. B. Tumor of the head of the pancreas. C. Partial obstruction of the jejunum. D. Enlargement of the left lobe of the liver. E. All of the above. So here we need to know that first of all, the correct answer here is B. Tumor of the head of the pancreas. Why? Because the enlargement of the duodenal sweep with downward and rightward displacement is often caused by a space occupying mass in the region of the pancreatic head. A pancreatic tumor in this area can compress the duodenum, particularly its second portion, leading to a characteristic deviation of its path. Option A cannot be taken here. Why? Because option A says abnormal position of the stomach. This could affect the position of the duodenum, but will not typically cause a downward and rightward displacement. Option C says partial jejunal obstruction. So this would more likely cause upstream intestinal distension without necessarily leading to this type of duodenal displacement, that is, a displacement of the duodenum downward and rightward. Option D talks about enlargement of the left lobe of the liver. This would primarily affect the stomach and proximal duodenum, but would more often shift the duodenum backward or to the left rather than downward and to the right. So the correct answer there is B, tumor of the head of the pancreas. Question 2. When performing a saphenous ligation for varicose veins, one of the following veins that you do not ligate is the dash vein. A. Superficial lateral femoral. B. Inferior epigastric. C. Superficial circumflex. D. External superficial pudendal. E. None of the above. The correct answer here, as you can see, is the inferior epigastric vein. Why? Because during a saphenous vein ligation for varicose vein treatment, the main tributaries of the great saphenous vein are ligated at its junction with the femoral vein. These tributaries include the superficial epigastric vein, not the inferior epigastric vein. They include the superficial circumflex iliac vein, which we can see there, the C option, which makes it correct. The superficial external pudendal vein, that is the D option, which makes it correct. And the superficial lateral femoral vein, the A option. However, we need to remember that the inferior epigastric vein is not one of the great saphenous veins tributaries. It is part of the deep venous system and drains directly into the external iliac vein. That is the reason why it is not involved in saphenous vein ligation. Question number 3. The cause of traumatic subdural hematoma is often A. Fracture of the skull. B. Extensive head injury. C. A severe or mild head injury. D. A tear in the middle meningeal artery. E. All of the above. So here the best answer is C. We need to retain that a severe or mild head injury, or we can say in general that traumatic subdural hematoma, the mechanism is rupture of bridging veins that cross the subdural space. And this rupture can be caused by head trauma, whether severe or relatively mild, especially in elderly individuals or those on anticoagulants. So that makes the C option the best. Question number 4. A patient with a gastrojejunocolic fistula is experiencing rapid weight loss and diarrhea. These symptoms can most likely be attributed to which of the following? A. Loss of food from the stomach into the colon. B. Loss of hydrochloric acid from the stomach into the colon. C. Inappropriate diet. D. Irritation caused by gas and colonic contents entering the stomach and duodenum. E. None of the above. So here the correct answer obviously is the A option, which says the loss of food from the stomach into the colon. So here we need to know that a gastrojejunocolic fistula is an abnormal connection between the stomach, jejunum, and colon. This results in the direct passage of undigested food from the stomach to the colon, bypassing normal intestinal absorption, which primarily occurs in the small intestine. So the main consequences of this bypass is that there will be rapid weight loss since nutrients are not properly absorbed. Severe malnutrition will occur. Secondly, one major consequence of this bypass is diarrhea. So this is explained by the sudden and inappropriate arrival of undigested food in the colon, which will disrupt osmotic balance, leading to diarrhea. As of what concerns the B option, the loss of hydrochloric acid from the stomach into the colon, we need to know that while gastric acid may irritate the colon, it is not the main cause of weight loss and diarrhea. The C option talks about inappropriate diet. A poor diet may worsen the condition of a patient, but we cannot assume that it will directly cause these symptoms that we have seen here. And even if it will not be that rapid. The D option, irritation caused by the entry of gas and colonic contents into the stomach and duodenum. So this may cause nausea and vomiting, but does not lead to rapid weight loss and diarrhea. So the best option remains option A, loss of food from the stomach into the colon. That is a consequence of the gastrojejunocolic fistula. Question 5. Of the following nerves, one that is most commonly injured in a shoulder dislocation is A. The median nerve, B. The axillary nerve, C. The radial nerve, D. The ulnar nerve, E. None of the above. So the best answer here is B. The axillary nerve. So here, what lesson to retain is that the axillary nerve is most often injured during a shoulder dislocation, particularly an anterior dislocation, which is the most common type of shoulder dislocation. This nerve runs just beneath the shoulder joint and can be stretched or compressed when the humeral head moves. An axillary nerve injury, it is important to know, will result in weakness of the deltoid muscle and a decreased sensation in the shoulder region, precisely the lateral deltoid area. So that is what I can give you as correction as far as these questions of surgery are concerned. So I would like you to share so that your other classmates or friends can be aware of the solutions to these questions, which you obviously meet as you prepare for your exam. And then you can equally like and subscribe to this YouTube channel to always keep updated with the publications in this YouTube channel. Thank you. And not to forget, we need to know that a penny saved is a penny earned. So in life, we need to always save. We need to always save what we earn for the future. Okay. See you during our next publication.